and good afternoon. It's Thursday, August 7, 2025. I'm Dr. Duke Majan, CEO and founder of Duke Spine Institute. We broadcast and stream live spine surgery every week. We've been doing that for 11 years. 11 years, you can go back and watch thousands of spine surgeries done here at Duke Spine Institute. Those surgeries are all done live, unless our patient says no. This patient comes to us from Florida, and he basically has back pain that goes into his legs. He has 2 herniated discs on the left, L34, L45. He has 1 herniated disc on the right, L45. So we're going to be doing a bilateral L45 and a left L34 Duke laser disc repair. You can also see from the x-ray he has a spondylolisthesis, which is a slippage of the bones. All right, so give me a minute while I access the disc. I'm going to use a needle to do that. I think this looks like a good entry point. Num num. The first thing we have to do, this is his back, we have to place these needles into the disc that we're going to repair. Now to do that, we're going to first put a little numbing medicine as we go in so that it makes it more comfortable for the patient. Now he's asleep, he's getting IV sedation, propofol sedation. Some of you know it as twilight sedation. Right, Dr. Berndes? I think Dr. Berndes is zoned out onto the anesthesia. So, all right, shot. If you have any questions, feel free to ask. Happy to answer them for you. Keep the questions related to spine topics. We've got Henry for another 2 surgeries this week, and then he's going to be on vacation. Lily will be following, basically taking over. AP, knife. Go ahead, Jordan. Incision. That looks perfect. We're going to go ahead and make our incision. It's 7 millimeters. I'll place the second needle, which is going to go into the L45 disc. I can't tell you who this patient is, but I can tell you in my book he's a VIP. Shot. He's law enforcement. Florida law enforcement. These are the guys who take care of us, guys and gals, who protect us, keep us safe from criminals. All right. If you have any questions, feel free to just type them in the box and Henry will ask me. In the meantime, Henry, I think it'd be good to show the audience what are the most common causes of chronic back pain. There are about 30 things, folks. And you guys see that slippage right there?
Yes, we do.
Show us the slippage, Jordan. That's called a grade 1 spondylolisthesis. That's one bone slipping on the other. Now, if we go down to the sacrum, that's sacrum bone. The first bone above that is L5, L4, L3, L2, and you can't see L1. But we're fixing 2 discs, L34, L45. We are not fixing the spondylolisthesis. Why? Because spondylolisthesis does not need to be fixed. Lots of people are told by their surgeon, you need to fix your spondylolisthesis with fusion, but it is not true. I used to believe that years ago, and then I realized it wasn't true. AP? Okay. Spondylolisthesis does not need to be treated at all, as a matter of fact. It doesn't cause symptoms unless it gets to be grade 3 or grade 4. Perfect. So, lots of people are shown their x-rays by their doctor. Go ahead. And the doctor says, oh, look, you have a spondylolisthesis. You need to have a fusion surgery. But people don't want fusions because they don't work and they cause problems. Fusions are invasive and dangerous and end up causing more harm than good in most cases. So stay away from spinal fusion. Talk to Duke Spine Institute about alternatives to spinal fusion, such as Duke Laser Disc Repair. Much better option than spinal fusion. Sean? All right. Sean? I'm Dr. R. Deukmejian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% 99% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Okay, thank you, Henry. You saw from our video that the most common reason people get lower back pain is coming from the disc. And it's really an injury to the disc where you get a tear in the wall and then you get a herniation stuck in the tear called a herniated disc. But it's not the part that's sticking out that causes back pain. It's actually the part that's stuck in the tear that causes back pain. He's had back pain for 25 years. He's suffered with it for 25 years. Now, we love our nurses, and we also love our law enforcement. So they protect us, keep us safe. So this patient has disc pain. I checked him for the other 30 causes. He didn't have any. Look at that. There's the inflammatory tissue right there. That's the annular tear inflammation. We're looking at it. It's pink. That's what we need to get rid of. And that's what we're going to use the laser mostly to get rid of. Any questions?
Yes, we have a question coming from Carolyn on YouTube.
All right, sure.
Asking, can doctors tell by looking at an x-ray what grade my spondylolisthesis is? Mine hangs past lower vertebrae much more than your patient. What do I do if it's grade 4?
Oh, well, there's grade 4 is, I've never seen a grade 4 in 30 years as a neurosurgeon treating spine problems. You hear that? What do you want to do?
Just hit it one more time, that's it.
It's okay? Or stop?
Let's stop.
Yep. All right, so we're going to change the laser out. Give us a second. That said, grade 1 is like between 1 and 25%, okay? Grade 2 is 25 to 50% slippage. Grade 3 is 50 to 75%, and grade 4 is 75 to 100. I think I've seen probably 5 grade 3s in my career, and I've seen a whole bunch of grade 1 and grade 2, like thousands. And then I've seen also 0 grade 4s, 0. Grade 4, your spine is basically, the upper spine is falling off the lower spine, okay? It's virtually impossible to happen, but it can. It's not 100% impossible, it's just very unlikely. Okay, that said, I would love to see your MRI and do an examination. I could tell you exactly why you're having pain if I could do an MRI review with you. So my advice, anybody with pain, do the MRI review. It's free. We don't even charge you. You can do it from the comfort of your home. So all I need is your MRI. I need you to fill out your form. Ready? So is the fiber?
Looks like it's the fiber, yes, sir.
Not the actual laser.
No, there isn't.
All right. Great question, by the way. Thanks for asking. All right, that said, we're working on zapping away the bad tissue. Look how nice this laser's working. My God, it's working so good. It just chews up. What setting you guys have this on?
I have it on 52.5.
52.5 watts or joules? Which one is it?
It has to be probably watts, for sure.
Anybody know what watts is? Watts is a measure of work, right? It's energy times time. So it's the amount of energy you're giving times the amount of time you're giving it. Cut the time in half, you cut the watts in half. All right, let me have the grabber. So far, any other questions?
At this moment, no current questions. Just a comment coming from Ronnie on YouTube. Oh,
Ronnie or Lanu?
Ronnie.
Oh, hi, Ronnie.
Yes. Oh, and we just got a question, but the comment coming from Ronnie saying, "You are the best doctor."
Oh, you're so kind. It means the world to me to hear people say that. I try so hard to help people understand what's wrong and fix them. And unfortunately, there's a lot of haters out there. It doesn't matter how good you try to be, how much you try to help people, they're just going to hate you. And it's good to hear from positive comments once in a while, you know? So thank you. Thank you. It means a lot.
We have a question.
And I do want to say something. Honestly, I couldn't do this alone. A lot of people think, hey, there's Dr. Duke operating, but what you guys don't see all the time is all the people that make up Duke Spine Institute. And we have 70 employees, 70. That's a lot of people. And I would not be able to do anything that I do without all those 70 people helping out. We have great people working here now. We didn't have great people working here. We had great people working here a month ago, but we had also some very bad people working here. That we finally found them out, and they're gone. Thank God, they're gone. But sometimes the bad people hide in plain sight, and you don't realize how bad they are until they do something very horrible that really hurts not you necessarily, but all the people around you, okay? And God knows we've had our share of those experiences like everybody. There's always haters out there that want to see you fail. They want to see you fail, but what they don't understand is they're hurting other people when they do that, you know, when they do bad things. They're harming our patients and they're harming our staff, not me. But thank you for the comment. Thank you. It means a lot. Yes, Henry, what do you got?
Question is coming from Warren on YouTube,
Warren, nice.
asking, Dr. Duke, will you ever invent some kind of silicone type material to inject into the back of the disc after you laser it?
Yeah. Well, Warren, it's a great question. Believe it or not, there are much smarter people than me that have thought about that exact thing years and years ago, literally like 40 years ago. And they've been doing experiments. You just haven't heard about them. And I'll tell you why you haven't heard about them, because they don't work. See, what happens when you do this type of surgery and then you put silicone or any other type of gel, like there's a product called hydrogel, right? And that's under development, I still think. I don't think it's been FDA approved yet. But the problem is they put it in here and then the patient stands up for the first time and then it squeezes out. And if it doesn't squeeze out as soon as you stand up, it squeezes out within a few weeks of just regular movement. So that's why those things have never worked, because there's so much down force on the disc in your lower back that it pushes anything you put in it, it just shoves it out. It's a miracle how this disc works. I mean, it's really quite a structure, an organ, that it performs so well an entire lifetime without problems. And the only time we have problems is when you herniate it and you get a tear. So Henry, let's go through that. Let's show our audience how discs become damaged and how we get these herniations from the damage.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. How's our irrigation, guys? Good?
Hector.
How's irrigation? Are we running low? Because I'm starting to see some... No, it's fine. It's fine. I think we're just getting a lot of debris, that's all. That's why it's clouding up. It's fine. All right, so thank you. You've watched now how the disc becomes injured through trauma. You get a tear in the back. At the same time as that force, that really strong force is applied to the disc to tear the back wall. That's an accident, by the way. It's a fall. It's a sports injury. It's like you're playing football. You get the football and some guy tackles you or gal tackles you and you get hurt, right? You hurt your back. Well, that tackle or that injury to your back, it causes a tear to form, just a sudden rip in your back wall. And it also crushes your nucleus pulposus. And what happens then is you get a squeezing out of the nucleus pulposus fragments that are crushed and fragmented. They squeeze out through the tear. And then they get stuck inside the tear. The tear is long. It's not a short tear. It's a long tear. And that long tear, you see how long it is? That's pretty long. And that tear basically holds those fragments in it and causes inflammation to start up, which is what you're feeling, your back pain. That's what happened to this patient. He basically injured his disc, and with trauma, could have been a work-related injury, could have been a football injury. We don't know the history enough to know. Sometimes it even happens when you're a baby, like a fetus, or coming out of your mom's womb, you know, or dad's womb these days, I guess. But you like that, Nikki? All right. So as you're getting pulled out of that womb by the OBGYN doctor, they could pull a little too hard and cause a spine injury. Believe it or not, I hear about this all the time. People say, oh, I don't know when I injured myself. I have no history of trauma. But, you know, I've seen babies get delivered when I was a medical student, and those OB-GYNs grab that head and body and they rip it out of there pretty forcefully. So I think a lot of spine injuries could actually happen during the birthing process while you're giving, you know, while the baby's being born. And then, of course, they don't have pain. And if they do, they don't complain about it. They're a baby. They can't talk, right? And so basically, I had one mother one time. She said, there's something wrong with my baby. And she got an MRI of the baby's spine. And it showed a herniated disc. Literally, like, this is like a 4-month-old baby. A herniated disc at L5S1. Like bulging out, herniation. And I'm like, wow, you know, because obviously the baby didn't get into a car wreck or sports injury or slip or fall or anything like that. We just were born. And they had this disc herniation. And I've started looking at young people that contacted me, and a lot of them have disc injuries. Okay, it could happen during the birthing process. I think we need more awareness about this. I've tried to raise awareness through this broadcast talking about it, but I don't think anyone really seriously paying attention. But it's a significant issue because I think how's irrigation? Because it looks like it's dwindled. I think we have to really start looking at the birthing process and how that could possibly be causing disc injuries. Do we show the audience how we repair these damaged discs?
Not yet.
Let's do that, and then we'll take some more questions.
Of course.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right. We'll take the questions. I'm laughing because our next patient apparently has worn a lot of cologne to his surgery. And I think that's wonderful. He wants to smell nice for everybody. But unfortunately, I'm a bit allergic to some of those strong scents. So we were just talking about how to manage that issue. All right, you saw the video. You can see how we use the endoscope to find the tear. We use the laser to debride the tear. And that is how we cure discogenic back pain here at Duke Spine Institute. Cure it. It's not something anybody else can do for you. You have to come to Duke Spine to get this treatment. All right, let's see who's next.
This question is coming from Carolyn once more on YouTube, asking, doctor wants to do a lumbar laminectomy. My doctor wants to do a lumbar laminectomy for spinal stenosis. I saw a doctor on YouTube saying that they don't do that now. Instead, they go down the spine and use ultrasound to remove bone. What are your thoughts?
Yeah, so thank you for asking your question. And who is asking this question?
Carolyn.
Carolyn. Carolyn, listen very carefully to me. Whether you have an ultrasound to remove your bone, or you use a drill to remove the bone, or a Kerrison to remove the bone, any bone removal from your spine is not what you want. It's going to cause instability. So the ultrasound is just a gimmick. We also have an ultrasound, but we don't use it because it's only used to remove bone. And you don't want to take your bone out. You see the surgery we're doing right here? This surgery fixes spinal stenosis, exactly what you've been diagnosed with. But it does it without removing bone or ligaments. So, long story short, here's the problem. Number one, ultrasonic removes the bone, your normal lamina, your normal facet bone. You don't want to do that. Number two, the ultrasonic probe cannot remove disc herniations, and that's what's causing the stenosis. So it's really just a gimmick. I would not go with the ultrasonic. We don't ever recommend it because it's a horrible treatment. It's just a gimmick to get people to come and do surgery. We don't believe in gimmicks here at Duke Spine. We do the very best surgeries available in the world. I've done probably 3,000 laminectomies in my career. Most of them were done with fusion. But I'm telling you, you don't need to do a laminectomy. You don't need to do ultrasonic. Totally dangerous and unnecessary. All right, let's hold pressure here and let's get this next disc done. We're going to go for the L3-4 tear, and we're going to be treating his spinal stenosis. We're also treating his back pain. By the way, spinal stenosis does not cause back pain. It only causes leg symptoms, weakness, numbness, heaviness of your legs. That's what spinal stenosis does. It doesn't cause back pain. So if you've got back pain, you're going to want a treatment for the back pain. And this is the best treatment in the world for back pain. Laminectomy does not treat back pain. It makes it worse. Ultrasonic does not treat back pain. It makes it worse. Come on, Jordan. Thank you. Great question. I'm glad you asked that question. By the way, Henry,
Yes.
let's put on our website. Folks, check this link out. Henry's going to give you a link to our page on ultrasonic spine surgery and why you should avoid it. Hold on. Yep. He's going to put that link in the window.
Indeed so. Just one moment.
Any other questions?
At this moment, no current questions.
Is he okay? Doing good? All right. One disc down, two more to go.
All right, link is in the chat.
Yeah, so check out the link in the chat that Henry just posted. And that link will take you to our webpage on ultrasonic spine surgery. And you're going to learn the truth about it. You may not like what you read. It may make you upset. But it's basically just a gimmick to get people to go there and get that surgery done. And I would be doing the same thing if it actually worked, but it doesn't. By the way, look at the inflammation. You guys see the pink? That is exactly what's causing his back pain.
Yes, we do.
And I love it because it's white, pink, and blue. I mean, what a pretty color combination, right? It's one of my favorites, pink and blue and white. Red, white, and blue. I'm very patriotic, right, Nikki?
Yes, you are.
We like the red, white, and blue. Watch that fiber. It's about to hit my face. All right. Keep the questions coming. I like answering your questions. By the way, Henry, didn't
Yes,
the
sir.
movie Spine Scam get released on YouTube? So it's free
Yes, it
for
is.
everybody to watch. Folks, if you want to learn a little bit about the scams, patient scams that are happening in the world of spine surgery and spine care, check out the movie Spine Scam. It's the first of a series of movies, we hope. The only way it's going to be a series if you guys support it. We need 2 million views for Netflix to consider picking it up and doing a series. I've got at least 6 more movies I could make to expose all the corruption in healthcare. And I want to make those movies, but we can't do it without your support. So check out the movie Spine Scam, and you're going to start learning about why spine surgeons recommend invasive surgery with screws and rods like fusions, artificial discs. It has a lot to do with large corporations profiting off of you, the patient, getting these invasive surgeries you no longer need. All right.
Link is in the chat for Spine Scam, so
Thanks,
they can
Henry.
watch it when they want.
Thank you.
And as of now, no current questions. So,
All right. Well, I got to do something then.
Oh, we just got a question.
Before we take the question, I want to do a shout out to Kimmy.
Yes.
Kimmy. All right. So Kimmy works here at Duke Spine. She's amazing. She's works in our clinic. She helps see patients. Kimmy started working here a few months ago, and she's learned so much while she's been here. She has her big sister Lily, who also works here. So I'm going to do a shout out to Kimmy and Lily, who both work here at Duke Spine and help take care of our patients. And they're very much loved by patients and employees alike. So shout out to Kimmy, one of our top employees at Duke Spine Institute. I'm going to miss you, Kimmy. It's her last day today. She's going back to school. She'll be back in December. So don't put your surgery off till December, though. All right.
Of course. Appreciate you, Kimmy, as always. And now we have a question coming from Carolyn, once more on YouTube,
Sure.
asking, what procedure for my stenosis should I have done? My feet and lower legs go numb.
Yeah. So, Carolyn, great question. The best procedure in the world for spinal stenosis that causes pinched nerves like yours is the one you're watching right now. It's called the Duke Laser Disc Repair. Henry, would you put a link there for Carolyn or anyone else that wants to learn more about Duke Laser Disc Repair? That's the surgery we're doing right now. This is taking the pressure right here. You see this, what I'm grabbing? That is the herniation that's pinching his nerves. And that's why he has leg symptoms. I'm getting rid of it. This is the right surgery, the proper surgery, the best surgery for spinal stenosis. Every other surgery, like the ultrasonic or laminectomy, those surgeries do not treat the actual cause of stenosis. The actual cause of stenosis is a herniated disc, pinching the nerve from the front. But those surgeries all go through the back. And what they do is they remove the bones and ligaments in the back of your spine behind the nerves rather than taking out the herniation that's pinching the nerve from the front. But this blue stuff you're seeing is the herniation. and that's what we're removing. That's why this surgery is the very best in the world. Now, another surgery that takes pressure off the nerves by removing the herniation is the original surgery done for unpinching nerves. It's called a microdiscectomy, okay, microdiscectomy. But the problem with microdiscectomy is that the surgeon has to take the bones and ligaments out of your spine to get down to the herniation. We don't do that. We go around the bones and ligaments and we leave them alone. That way you still have them and they're normal when we're done. This truly is the best surgery in the world for stenosis. The one you're watching right now, the Duke laser disc repair.
As of now, no current questions. So in the meantime, Dr. Duke, we recently just talked about laminectomies, microdiscectomies, ultrasonics.
Oh, yeah.
And all of these are just very invasive treatments compared to the Duke laser disc repair. Why don't we show the audience the comparisons from the DLDR versus all invasive back treatments?
I love it. Let's do that. We're going to show you this video that Henry and I created that is going to explain to everybody why the surgery you're watching right now is better than all the other treatments out there. Hi, I'm Dr. Duke Machen. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke laser disc repair. We've been performing the Duke laser disc repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. All right, welcome back. We've just finished fixing 2 discs. We're going to go fix the third one, which is really the same disc we fixed, but it's the other side. So look at that, folks. 2 discs fixed with that little incision, no bleeding. And he'll be sore overnight, but then that pain will be gone by tomorrow. Completely. No pain meds, by the way. Our patients that have this surgery don't take any pain medication, no narcotics. Somebody open a loaf of bread? What is that? Is that from your lunch? You know, if you're going to have ultrasonic surgery or laminectomy, your surgeon's going to give you very, very dangerous narcotic painkillers like Dilaudid or oxycodone, Percocet, hydrocodone, whatever. There's so many different ones. The point is, when you're taking those drugs, you are toxifying your body, number one. Number two, you're putting yourself at risk for getting addicted or somebody else around you getting those drugs and taking them, you know, somebody in your household, for example. And you could become addicted to them. So there's all kinds of bad stuff that happen with narcotics. This surgery uses 0 narcotics. We haven't given narcotics for this surgery in probably 6 years. We were giving people a little bit of narcotics afterwards, like some pills, and every time they came back the next day, I would ask them, did you use your narcotics? They would say, no, I never used it. So we're like, well, then why are we giving it to them, right? Like, what's the point? Okay, I need you to hold. Here. I have to cut the skin just a little bit more. I can't really see. I need light. Should be good. 7mm incision, Band-Aid incision. We're going to go fix the right L45. There we go. There was just a little bit of skin still there blocking. That's what happens when you make a small incision. It's kind of hard sometimes to see the entire incision. I think this dilator is clogged. Oh well, sorry. Got the burned his eye on me. Like, what do you mean you're not giving any local? Right?
Put it in there, you can put it when you take out the gut.
Huh?
On the side?
No, you can put it when you take out the gut.
Yeah, but then we're in the disc. We already put it in the discogram material, so it's already there. We actually put numbing medicine in the discogram material so they don't feel pain. It really helps, I think. All right, any questions?
Yes, we have a question coming from Lanu, once more on YouTube. Ask,
Wait. Yeah. Go ahead, Henry. I got to pull this back.
no worries, asking, is herniated disc and stenosis the same?
Ah, ha, ha. Brilliant question. Yes, a herniated disc causes stenosis when it's herniated in the back, right where we're operating. Yes. So a herniated disc in the front of the disc does not cause stenosis. A herniated disc on the side of the disc does not cause stenosis, but a herniated disc in the back of the disc does cause stenosis. And that's what pinches the nerves, and that's what surgeons do laminectomies for, and discectomies, and ultrasonic is for that stenosis caused by a herniated disc. When instead of doing those terrible surgeries, they should be doing this surgery. This is the best. This is why Dr. Cambin invented this surgery. Parvis Cambin invented this surgery so that you don't have to remove the bones and ligaments from the back of the spine. All right. Last disc. Here we go. Dr. Cambin was a very smart man. And he basically was a trailblazer in his time. He's one generation ahead of me in spine surgery. He was practicing in the 80s and 90s. I was practicing in the 90s and 2000s. Look, this is not
Victor, we need more
the
pressure.
right, this is not,
Please.
okay? It should be shooting out, okay? Not enough irrigation. All right, who wants to see me lose it? Come on. No, not better. I think, did you just play with the suction or the irrigation? Look at that. I've got everybody over there helping out. What a great team I've got. Oh, there it is. Look at that. Look at that.
Looks much better, yeah.
Look at that, guys and gals. That is real irrigation. You see that?
Yes, we do.
All right. It's like a squirt gun. If you show up at a pool with a squirt gun that does this right here, okay, you guys see that? If that's your squirt gun at the pool, you're in trouble because somebody's going to show up with that. Remember those days? Flomax. Give it some Flomax. Luis, that was the line of the freaking week, man. That was awesome. Give it some Flomax. All right, here we go. We're taking the herniation out. All right, good. I got 10 minutes left. 10 minutes left. Our next patient, who took a bath in men's cologne this morning, is from Israel. And he traveled all the way here to Duke Spine to have his neck and back fixed. We're going to start with his neck and back today. We'll be doing a cervical facet, a lumbar facet, and a lumbar Duke laser disc repair. So he's got disc pain and he's got facet pain, both disc and facets. And with respect to facets, he's got neck facet pain and he's got back facet pain. We're going to cure that pain for him. I'm excited. He's a welder. He works on big projects in Israel. And I don't know how the heck he got out of Israel, but to come to the United States for surgery, but he did. Good for him. He must, huh? He's an ambassador. Yes, that's right. He's a good guy. I'm looking forward to taking care of him. At Duke Spine, we take care of everybody. Doesn't matter where they're from. We don't care what your religion is, what your sexual orientation is, what your race. None of that matters. What matters is you're a human being and you're suffering, and we want to stop that suffering for you. And if we can do it, we'll do it. There's the herniation, by the way, stuck within the annular tear. You guys see it?
Yes, we do.
And you got the herniation plus scar tissue. The blue stuff is the nucleus. The white stuff is the scar tissue. And some of that is also herniation that didn't get stained with the blue dye that we used. But the blue dye helps us see the pieces of herniation that need to come out. This is the safest, most effective treatment in the world for back pain. It's the safest, most effective treatment in the world for spinal stenosis in your lower back or neck. But if you're interested, do an MRI review. It's free. We don't charge. People from around the world do MRI reviews with me every week. And most important thing you're going to get out of the MRI review is a diagnosis. So what does that mean? It means I'm going to tell you why you have what you have, what's bothering you. I'm going to tell you how to fix it. It's up to you then if you want to get it fixed.
No current questions, but we do have a comment coming from Lanu once more on YouTube
All right.
saying there should be a TV series about your place like ER or Grey's Anatomy.
That's funny. Yeah, we're trying. Lanu, that's why we do this reality TV surgery. You know, we don't edit anything. It's all right out there. But all those programs like ER, and they're all edited. That means that they shoot the film, they shoot the footage, and then they go back and they edit it all and cut out the scenes they don't want. Here, we give you reality TV, the most reality TV there is in the world. Even if you watch other spine surgeons or other surgeons do surgery, they all edit the surgeries. They cut out parts they don't want you to see. We show you everything. We let you hear everything I say, which, you know, can sometimes get me in trouble, but that's okay. I want people to know the truth. All right. We're just about done. I've got about 5 minutes left at most. I'm not seeing much herniation left. You guys saw that little piece of orange there, red?
Yes, we did.
That was inflammatory tissue. These are all pieces of herniation coming out, thank God. We're almost done. I'm really excited for this guy. He's had back pain for what, 24 years? 25 years. And again, he's in law enforcement, and I respect my law enforcement. Now, I know not everybody in America does, but I guess it just matters how you're brought up, how you see the world, right? I don't get into politics, so don't worry, I'm not going to go down that road. There's no place for politics in the operating room. All right, piece of herniation right there. Just about done. I've got about 2 minutes left and we'll be finished with this disc. And now we're going to wake our patient up. He's going to go home today. He actually came here from South Florida, right? Central Florida with his lovely wife. I had the opportunity to meet her. She's probably watching this live stream right now. Oh, she's working. Huh? She's working. Okay, never mind. They're going to watch it later, I'm being told. Thank you, Nikki. Any other questions? Because we're almost done.
At this moment, no current questions.
All right, so last few pieces of herniation that I'm going to get. You can see the tear has gotten cleaner as a result of our work. That means it's going to heal nicely. This last bit right here is going to be the most painful part. You see all that inflammatory tissue there?
Yes, we do.
The reason there's more inflammatory tissue at the end is because we're in the outside of the disc. This is where the blood supply is. This is where the disc goes from being avascular to vascular. I got about 2 minutes, maybe a minute left. Just got to get this few chunks out. How's he doing, Dr. B? Got about 30 seconds. Any other questions?
Yes, we just got a question, 2 questions. We'll go with the first one coming from Professor on YouTube.
Professor.
Co-
All right.
Asking, how long does it usually take from your MRI diagnosis to surgery?
From the MRI review to surgery could be 1 day. We give you your surgical recommendation during the MRI review. And if you want to come in the next day and get surgery, we'll do it. We don't make people wait. We don't believe in making people suffer. So it's really up to the patient. We just need to do what's called a pre-op, and that's where we do a physical exam, check your heart, lungs, check your blood work, make sure everything looks good. And as long as you're medically optimized and fit, we do your surgery. So yeah, we could do it in a day or 2. All right, pretty much done here, and going to be closing up. Not really getting anything more out, just a few little pieces. All right, very good. Yep. All right, that was surgery went perfect, and we're going to close up. You can go ahead and show the audience maybe one of our past patients that had this surgery done for reference. But if you're having back pain or you know somebody with back pain, send them to Duke Spine. We can get rid of that pain.
Final question coming from Lanu, once more on YouTube, asking, can you imagine if people from 1860 see this? President Abraham Lincoln would run to meet you.
Yeah, I don't know. Did Abraham Lincoln have back pain? I know he had
He was tall.
Marfan's, right?
Yes.
So he did have a collagen connective tissue disease. He may have had back pain. Yeah, I would have loved to have met Abraham Lincoln myself.
And that is it for
Okay.
questions.
There is?
Oh, that is it for questions. Yeah.
All right, let's show our audience. You guys can see 2 tiny little cuts,
Yes, we can.
and we're done. He's going to wake up. He'll go home in an hour. He'll be awake in about 30 minutes. And good morning, I'm Dr. Duke Majan. 30 years of back pain.
Yes, sir.
Gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Duke Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that. And I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Duke, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Duke laser disc repair on your back and the Duke plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Duke laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Duke is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Duke and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Duke Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right.